Hey, Chris Cosby here, CEO of Parkridge Health System, coming with this week's edition of What's Your Why Wednesday. Today I have Michele Miller with me. She's the ACNO here at Parkridge Medical Center on McCauley. Michele, thanks for joining me.
Thank you for having me.
All right, so you're new.
I am.
How long have you been here now?
May 20th was my first day, I believe.
So about almost 3 months?
I'm saying
Or is that
2 months. 2 months, yep.
Yeah, but we're about to, I guess we're 2 weeks away from August. So
Yeah.
you're getting close to 3 months.
Yep, getting close.
Okay, all right. Where are you from originally? What's your story there? Family? Where you from?
So I am from Texas. I was born and raised there. And then whenever I was 23, I got a wild hair and said, I want to move to Colorado. And I did. And I've been in Colorado ever since. And have 2 children. One is a boy, 30, and a girl who's 27, who moved out here with me.
Okay.
And started my career at HCA there in Denver in the Continental Division, and have been with them, in Denver, 20 plus years.
Okay. All right. So what was your first job?
Oh gosh, my first job was at a kind of like a Claire's in the mall where you pierce people's ears and all that kind of thing. Yeah, that's where I worked. I can't remember the name of it, but that's a mall job.
What was your first job in healthcare?
My first job in healthcare was actually LPN. So I started out as an LPN for a doctor in a cardiologist's office.
So all the way from an LPN in a cardiology office to now assistant chief nursing officer here at Parkridge. Awesome.
Yep.
What a journey. Okay. So, we have good days and bad days.
Yep.
And I believe when we have bad days, something internally kind of gets us through it because it's just where we're at and what we do. And I think that's part of what's your why. So, what's your why?
Well, I was reflecting on this, thinking about our conversation.
Yeah.
And for me, and I don't know, it may sound corny, but I really believe it, that we are here for our community. And that's really important to me. And I take that seriously.
Yep.
I also don't think that it's a responsibility, but it's a privilege to take care of our patients.
Yeah.
Doesn't matter what they come from, where they're from, what's wrong with them. Like, to be the first choice of healthcare for the people in our community is what drives me.
Yeah.
So I believe in the Parkridge story, and I want to be part of the Parkridge story, and I want to make sure that we are continuing to take care of our patients safely and with good quality care.
So what I hear is you want to make sure we're a good community partner and making sure that we treat patients the way they should be treated, how we want to be treated, how we want our family to be treated.
Right.
That's what I hear you saying.
Yep.
Did I get it right?
You got it right.
Okay.
Yep.
All right. So I want to throw another random thing in there that I have yet to do on one of these videos. I heard it this morning. Living in Denver, Colorado, how long? In Colorado, how long?
Oh gosh, over 30 years.
And never went skiing.
Never
went snow skiing.
No, never.
Yeah.
Too cold.
Yeah.
No.
You put layers on.
That's what they say.
And you're really not cold once you put the right layers. Okay. All right. Well, I'm glad you're here. I'm glad you're part of our family. And thanks for joining me today.
Thank you, Chris.
All right. All right, guys. That's this week's edition of What's Your Why Wednesday. We'll catch you on the next one.